Hodgkin's lymphoma is one of the real success stories of hemato-oncology. The majority of our patients are cured with first-line chemotherapy, even if they've got advanced stage disease at presentation. But we do know that up to a third of our patients will relapse following first-line therapy. And for these patients, the standard paradigm is to take them through intensive induction chemotherapy and then through an autologous stem cell transplant. However, it can be quite a challenge obtaining a response to salvage induction chemotherapy, and there's now many different induction regimens that may be used. Some of these regimens are now incorporating agents such as brentuximab vedotin to obtain a response before the patient goes on to the autologous transplant. And some patients will really struggle. They will require multiple lines of salvage therapy before they can get to an autologous transplant. And these patients may be at particularly high risk of relapse following the autologous transplant. And therefore we need to think about other consolidation strategies following the autologous transplant. And then for a very small number of our patients with Hodgkin's lymphoma, they will relapse after their autologous transplant. And for these patients, they're going to prove to be a real challenge. They may receive palliative therapy, but if they're young enough and fit enough, we may want to try and get that patient to an allogeneic transplant, incorporating agents such as brentuximab vedotin, maybe incorporating the new PD-1 inhibitors to get a response and then take them to an allogeneic transplant. So there's many different strategies that we can employ to get these patients who are doing poorly with Hodgkin's lymphoma through various transplant strategies.